Are you administering vaccines? How's it going?
Yes, we are administering vaccines. When we get vaccines, we're giving it to our patients. One of the challenges is the availability of the vaccine. We clearly want more so that we can cover more patients. But as you just heard in that clip, we've already done over 1 million vaccinations already, and we want to do more as quickly as we possibly can.
How short are you, Dr. Vautrey?
Well, clearly we've got a massive population that we want to actually cover, but primarily we want to cover our most vulnerable patients as quickly as possible. So those patients in their 80s and above, healthcare workers, those in care homes, we have vaccinated many people already, but we are getting supplies as they come. We are giving them, but we clearly would need more, and we want to ensure that those vulnerable patients who are most at risk of hospital admission, most at risk of death, get protected as quickly as possible.
The goal, 15 million people by mid-February to be vaccinated, that the idea is that would unlock the economy. Can you guys do it?
We can do it if we get the vaccine. We're promised that the vaccine supply will increase in the coming weeks. That must happen for us to be able to do that. But my GP colleagues, practice nurse colleagues, and others who work in general practice, as well as those who work in hospital settings, are very much up for that challenge. But we can only do it if we get supplies of vaccines. We know that we've been fortunate. We've had many more supplies of vaccines than many other countries within Europe. But nevertheless, we can do more, and we will do more as soon as we get those supplies through.
Just to come back to this issue, you've mentioned it a number of times, Dr. Vautrey. It's about supplies. How much of a struggle is it to get supplies? If you could have more today, would you have vaccinated more people? You talk about kind of the fact that you need more. If you had had more today, would you have had the staff? Would you have had the capacity to be able to deliver those into people's arms?
Yes, we would. In most practices, they're working together in groups of 5 or 6 practices working together. In most parts of the country, that means a vaccination clinic maybe once or twice a week, covering about 1,000 patients with the vaccine that's provided to them. We would like to be able to do it every day. We would like to be able to vaccinate large groups of people every day. We could make arrangements for that. We could get the staff for that. There's real enthusiasm from our practice staff to be able to do that, very much willing to do additional hours to be able to do what they see as the #1 priority to protect our patients. So, yes, we could do a lot more if we had the vaccine coming through, but we recognise that in the early days of vaccine production, it's a complex business. It's a logistical challenge getting vaccine out to so many sites, but also producing it as well. But we anticipate that certainly in the coming weeks, as vaccine supply increases, we'll increase our activity. And we want to be vaccinating on a daily basis. That's our intent.
So when someone comes and gets vaccinated, what do you tell them? Because are you splitting doses? Are we just giving out the first dose to everybody and then hope production picks up enough to do the second shot?
Yeah, so every site that gives the first dose will also be the same site that gives the second dose. Now within the UK, we're following the JCVI and CMO's guidance, which is that the second dose is given 12 weeks after the first dose. And we will be giving those vaccinations to people. So it not only means we have to vaccinate people once, we vaccinate them twice. And we have to do that for everybody.
Dr. Vautrey, let's talk about what is happening with the virus, the other side of the equation. The Prime Minister is talking about the possibility of tighter restrictions, maybe going back to the restrictions we saw in the early part of next year. Given what you're seeing, given what your colleagues are seeing right now, do you think that may be necessary?
Yes, we are seeing a rapid rise in the spread of coronavirus amongst our community, particularly in the southeast and the Midlands, increasingly elsewhere around the country. We have to go back to those basic principles of keeping your distance, wearing your face mask, washing your hands well. This virus only spreads when there is an opportunity for it to do so with direct contact between individuals. And we need to ensure that that is limited as much as possible so that we can stop the spread in our community. It's vital that we do that because the NHS is under huge pressure at the moment, and that pressure is only likely to increase in the coming weeks. And what we want to avoid is the impact on many other patients who need the care of the NHS, people with cancer, heart disease, other conditions who need our care. We're trying to provide that at the same time as responding to the massive challenges from COVID-19. But we want to do that, and the only way we can do that is if people follow the rules and keep their distance one from another.
Are we 100% sure that the measures like mask wearing, hand washing, and social distancing about 6 feet, is that appropriate with the new strain that's now spreading everywhere?
Yes, I think whilst the strain is potentially something more infectious and spreads more readily, the measures to prevent that spread are exactly the same. We have to keep our distance one from another, and we have to ensure that we limit the opportunity of that virus to spread within our households. So going back to those measures back in March and April that people followed so diligently and which did see a drop in the prevalence of infection in communities, that's what we must do now. And we must be very careful not to think that the advent of the vaccine is going to give us a get-out-of-jail-free card very, very quickly. It's clearly really important, but the most important thing at the moment is to stop the spread in our communities.
When do you think we'll be able to be getting back to normal? Obviously, this is a big political call that has got to be made. But from a medical point of view, in terms of the trajectory the BMA sees at the moment, is mid-February realistic? Are my kids going to be going back to school at that point? A lot of people out there are struggling to balance childcare and trying to earn a living. What is your expectation in terms of the trajectory for that return to normalcy?
I think it is really difficult to predict that. I mean, the government have talked about Easter, in April, as being a time, of that being a possibility. Obviously, the target is to vaccinate the most vulnerable people by the middle of February. And if you give us the vaccine, we'll certainly try to do that. But even when those patients have been vaccinated, it will take time for the pressure on the NHS to relax. And for the situation to become more under control, which is why we have to maintain our guard. Certainly in these coming weeks and maybe months ahead, we need to keep up with that. It's going to be a long time before we can vaccinate the whole population, and it's only then that we can really see the benefits of the vaccination programme. But certainly we'll be doing our best to protect our most vulnerable patients as quickly as possible.